Okay, so we'll go ahead and get started. So just know that, you know, I really want to empathize with all of you. I know you have a huge undertaking and a task ahead of you in terms of creating school guidance. Obviously, I'm sure all of you realize that we're very much in a crystal ball type setting in terms of there's so many unknowns in relation to COVID-19. And we're all sort of trying to do our best to make effective school plans with the goal of trying to get back into our schools with children is the ultimate goal for us moving forward, and trying to do it in the safest way possible. So we have gone through and looked at the roadmap, which I'm sure all of you have maybe memorized by now, I'm not sure, but looked at it cohesively and really wanted to try to address components listed within the roadmap that specifically relate to sentences like get with your local health department or contact your local health department in relation to working through some of these strategies. So what we thought would work best is if we just tried to address that in a group setting by doing this presentation, and then we realize we don't have all the answers today, and that things may change between now and when we're considering about schools reopening. And so we're trying to be flexible, and as many of the superintendents heard me say in the very beginning when we talked in March, is that obviously this is a fluid situation and things continue to change, and we have definitely seen that play out in the last 4 months. So in terms of where we're at, a couple different factors of things that we are specifically looking at. One is obviously what is the data telling us? Where are we seeing ourselves in Saginaw and this region? And the MyStart map is one that we've been pointing a lot of just public to and partners to, that are always wanting to see what our data is looking like. And so in Saginaw, we've still had pretty much a downward trend with some upticks as we've begun to reopen and people getting back into work environments and other settings. Our positivity rate is now at about 2.8%, which is a 1-week decline that we've seen. And so we're tracking that over time. The first graph on the upper right that you see here is really that positivity rate. So of all the tests that we're doing, which is about 300 to 400 tests a day in Saginaw. We're basically, of all the tests we're doing, that positivity rate has been hovering around 3 to 4%. So the guidance really, I guess maybe the goal for Michigan, as stated by the governor and such, as we looked at some of this data, is that we want our positivity rate to be 3 to 4%, you know, to be lower risk amongst all those that we're testing. And so there's a lot of questions around positivity rates and if we've dramatically increased our testing, and we have increased testing over time, although it's not been that dramatic. It's pretty much averaged about that 300 tests or so and upwards to 400 a day. So that's a good thing. That's a good indicator when overall positivity rate is declining or at least maintaining. And we have seen it maintaining from this graph throughout pretty much the month of June and now July, where we've hovered right around that good goal of a positivity rate. In addition to looking at cases over time. So this is kind of like that epi curve look or lens at the number of daily new cases a day. This is where we're seeing a little bit more fluctuation. And we were on a 4 to 6 week decline. Obviously, you can see when you look at this graph, which is the lower right-hand side, that we really dipped around the mid-June timeframe where we were pretty low, almost meeting those 7 cases per million within Saginaw. And then we've seen a little bit of an uptick. And as you know, as orders were lifted and more people are getting back into the work environment, that's what we're seeing now. So we're monitoring that, continue to monitor that closely. But we have seen a little bit more of an uptick. And frankly, we kind of expected that with 4th of July weekend. We're almost 2 weeks out of that. And so cases may continue to come in as we see more interaction around those holidays. However, one of the indicators that we're also monitoring is our averages. So as you can see, when you look at the epi curve, there are certain spikes, right? One day there may be 30 cases, the next day there may be 2 that gets reported. And so we try to average that out to give us really a good trend. And so the lower left-hand side graph that you see here is looking at 2-week average cases and plotting that over the months of late June through early July. And you can see it's been a slight downward trajectory. And this is an indicator that really the court systems are using, and you may have heard this gating criteria for reopening. So a lot of these factors play in as we continue to look at the data. And so what I'd be interested to know later on in our conversation is, are there any specific sets of data that you guys need or want from the health department, and if there's a frequency in which you need that? Obviously on our SaginawPublicHealth.org page, we supply a lot of this information. The My Map info is updated weekly with these numbers. Well, daily with the numbers, but weekly with the trends. But if there's other things that you need or want from us, let us know. We'd be more than happy to try to accommodate that. So for the purposes of today and trying to wrap around what you guys are trying to accomplish with your school planning is really working on the premise of, we still know we're in phase 4 of Michigan's MyStart Safe plan. And so that really relates to item number 3 here in your roadmap, which, so if schools were to open in the next week or 2 weeks or 3 weeks, and we're still in stage 4, or come late August and we're still in stage 4 or phase 4, it's still calling for schools to open for in-person instruction with more stringent required safety protocols. If we move into phase 5, obviously, you know, a lot of the restrictions get lifted. There's moderate required safety protocols if we're in 5, but the way that the other parts of Michigan are looking, high positivity rates increasing, the Lansing, the Grand Rapids, and now some of the Detroit areas sort of getting more red on the map. You know, I don't know that we're going to be moving to phase 5 anytime soon. So we probably, I think for today's purposes, should really focus on phase 4, which is the most strict of the requirements, right? So if we can sort of wrap our brains around that and make a plan that addresses phase 4, those other phases should ideally, or really be easier, right, as we begin to think about those. This table, this colored table here, is a document that we will be sharing with all of you. I guess just to preface too, as we go through this, you're going to see some specific documents that the health department has put together for schools, for all of you really, as resources. And we're in the midst of finalizing all those documents now, and we will be posting them to our website under the schools page on our coronavirus landing page. And I have a link at the end of this directly to share with all of you, and we can send that back out as well after this meeting, so that if there's guidance and things that we do specifically put together, feel free to use those as much as you want. This particular document was shared across statewide through our public information officers at other local health departments, and it really just tried to take the roadmap and make it very clear cut in terms of what's required. You know, there's strongly recommended, and then there's recommended within each of these categories around personal protective equipment, hygiene, spacing, moving, screening, testing, etc. Right? So they just took that and made it very bulleted, and so it just might be a good resource for you. And I thought it was helpful for some of our conversation today. So with that, I think we'll get into some of the specifics around the roadmap. And so Dr. Delisha Pruitt has joined us. So Dr. Pruitt, I will turn it over to you. And if you need to tell me to advance the slide, just go ahead.
Thank you.
My screen.
Hello, everyone. It is my job to talk to you from the medical perspective when it comes to COVID-19. First, we're going to talk about PPE, because I think this is the most important, one of the most important things that we need to talk about is teachers can wear a face covering, cloth, or disposable mask. We get a lot of questions about whether or not, if they can't tolerate medically, or for some unknown reason, claustrophobia or whatever, cannot wear a mask, then a face shield is an option, but it's an inferior option. Let me say that, because face shields shield the face, but they are open underneath and around so that you know, bacteria and or COVID or whatever can get underneath it. And so if you can't wear a mask at all, a face mask is an inferior option, but it is an option. We also want you to know that N95s are required for staff performing any aerosolized procedures, including like, for instance, nebulizer treatment, where we all know that if someone with COVID-19 obtains a nebulizer treatment, that COVID-19 can sit in the air for a while afterwards, up to hours afterwards. So if you have staff who give children nebulizer treatments, you need to reconsider that because of the caution about this staying in the air. And so we want to recommend that if you have N95s, great. If you don't, this may not be an option for you to do nebulizer treatments in your schools, okay? Next slide. We wanted to show this slide because it's really important for you to see the difference between symptoms of children versus symptoms of adults with COVID-19. As you can see here, they all have similar symptoms, with the exception to children usually don't complain of loss of smell or taste. But most common in children compared to adults would be, for instance, if you look at, everyone has fever, cough, runny nose, but children have more runny nose and congestion more often than adults. And you may say to me, Dr. Pruitt, like, what is the difference between that and, let's say, runny nose from allergies or runny nose from just a common cold? It looks all the same. That's what's so difficult about this. And so kids have more runny nose. They don't complain about muscle aches as much, but they'll complain about a sore throat. This could be an indication that the child could have COVID-19. You can also see at the bottom, they may have a red throat. But still, remember with COVID-19, it's not just cough, shortness of breath, and fever. You may also see nausea, vomiting, headaches, sore throat. So those are all common symptoms of COVID-19. It's really important for the school system to educate parents about signs and symptoms of COVID-19 because a lot of times what parents would do is to give their kids some Tylenol, Motrin, send them back to school, and then have you guys deal with that. And so it's important for you to educate the parents on when to keep the kids home and to know some of the common symptoms. Something as small as a runny nose could be a sign of COVID-19. Next one. This is something that's very near and dear to me and that I want to make very clear to all the educators out there. There is a syndrome called the multi-system inflammatory syndrome in children. And if you look at our map on the left side of here, there's 186 cases in 26 states. And if you look at Michigan, we're one of the states that has 20 to 29 cases of this syndrome. This is really important because as you see in our graphs here on the left side, that as our COVID-19 cases are trending downwards, this syndrome actually is going up, so trending upwards. And I wanted just to let you know about this syndrome because of its importance. First of all, it's an inflammatory syndrome that is similar to what we call Kawasaki disease. It causes a red tongue, red eyes, lymphadenopathy, and it's an inflammatory condition that actually attacks stomach, the lungs, the heart, and these children can die of this disorder. I know earlier in COVID-19, we said that it doesn't affect children very much, so we weren't very concerned, but this is a concerning syndrome in children. If you see that 62% are males, 32% are females, and it's more commonly in Hispanic and Latino children, African American children, you can see 25%, 31% for Hispanic, 19% for white non-Hispanics, and then other non-Hispanics, 5%, 22% unknown. You can see it goes across a wide variety of children from infant all the way to under the age of 21. So any kid under the age of 21 can get this syndrome. And what happens is they either have COVID-19 or exposed to COVID-19, and within 2 weeks, they start having this syndrome, which you can see here under outcomes, 2% of the children die. 70% of the children are sent home, discharged alive. From March, from when they did this study until May, 28% were still hospitalized. The median time that they stay in the hospital is approximately seven days. If you look at the highest level of care, 80% required ICU management, 20% just a regular hospital floor, and a large portion of them required ICU management, with 20% of them needing mechanical ventilation. So it's really important to say that COVID-19 affects kids less, but there's the syndrome out there that puts children at risk. Go to the next one. So what can we do to make this situation all better? Spacing, movement, and access are very important. All elements in this section are recommended. However, we strongly recommend this, and this is very important, especially when we get our first positive case. So we are letting you know that space, 6 feet, that should be 6 feet apart in the classroom and facing all the same direction. We want to limit the parent involvement within the classroom, and if you can eliminate visitors, whatever you can to decrease the number of visitors coming into the school is the most important thing. The less contacts they have with people from the outside, the less risk you have of contracting or spreading COVID-19. You know, with little kids, it's really important to, well, little kids and big kids to have markers for social distancing, floor tape so they know exactly where to stand. It's important because not only do we want to protect our students, but we want to protect our teachers, our faculty, our staff. And so we want to make sure that we put where the kids need to stand to protect our teachers from the children. And so that the kids should, where they should wait, where they should walk, where they should stand in the classroom. And one of the most important things is putting up signage for everyone to know what they're supposed to do and when they're supposed to do it. And keep windows open as much as possible to increase airflow, and this will help limit the spread of COVID-19 in the classroom. Next. You want to screen all visitors, and I know most schools do this already, we know this, but we want to screen all visitors, requiring hand washing, sanitizing upon entry, and strictly limit their movement in the building. We want to keep a log of people who enter, and I know you do that, what date and time they entered and exited, and where they went. This is important. If someone with COVID-19 went into the building, we want to know exactly where they went to determine the amount of exposure that the children or your staff have had. We want to limit student movement as much as possible, and this is really important. Can students enter through, exit through separate hallways into the classroom and stay in that room for most of the day? Can meals be delivered to the classroom? And then spacing out recesses, further space recess time to cohorts within the classroom with students only, and recess by class, not grade. Is that an option to keep cohorts together? Specials come to classroom, move staff, not students, okay? We really wanna stress that. If you can move the staff and not students, and no assemblies, no off-site field trips, anything like that. Our goal is to limit movement and to limit exposure, to limit COVID-19. Next one. Okay, screening staff. It's required that we have a plan for that, and we required in the plan says to coordinate with the public health department, and we recommend that all staff is screened. It would be beneficial, have staff arrive at staggered times through controlled entries, take temperatures if you can, ask screening questions, and we have a screening sheet that will be posted for you guys so you can see what appropriate screening questions are. Like I said, take the temperatures, and then have good record keeping of school staff attendance, their shifts, etc., so you know what staff was where, so that if we need to do contact tracing, we'll know where the staffs and what classrooms they've been or what work they did. Okay, so in regard to screening students, the CDC guidance states, because symptom screening are not helpful for identification of individuals with COVID-19 who may be asymptomatic or pre-symptomatic or infected with an unrelated virus, symptom screening does not prevent all individuals with COVID-19 from entering the school. So communicate with families on school expectations of home screening, and this is what we're recommending. Parents should screen their children prior to each school day, take their temperature, anything at 100.4 or over. These kids need to stay home, and we can develop a letter to help you communicate with parents. But before leaving for school, please make sure you do the following. These are examples that we will tell the parents. Does your child have a fever? Take their temperature. Is it 100.4 or higher? Has your child started to have any of the following: cough, runny nose, congestion, tired or achy, shortness of breath, vomiting, diarrhea, new loss of taste or smell? Has your child had any close contact with someone diagnosed with COVID-19 since they were last at school? Have you or your children been diagnosed with COVID-19? And if you answer yes, you should keep your child at home, and then it gives them information to access for information from the state, or they can call the local health department.
There we go.
Okay, so symptomatic students. Schools need to identify and isolate areas for symptomatic students, and this is strongly recommended. If you have a symptomatic student, you should put on a surgical mask on that child if feasible. Call immediately for the parent to come pick up that child and take the child out to the parent upon pickup with staff wearing a mask. We don't want a parent to come in who may be a source of infection to come in the building. You want the staff to take that child out with a mask on. Child may not return until they have a negative test or meet symptom-based strategy for returning off of isolation, which is 3 days fever-free without without any fever-reducing medication like Tylenol, Motrin, and improvement of the symptoms. So the cough is resolved, no shortness of breath, and 10 days from the onset of the symptoms, okay? After symptomatic student or staff is sent home, student and staff or staff should be tested right away. Students in rooms that were exposed should stay home until the test results come back. Wait 24 hours and disinfect the classroom if the test comes back positive. We'll work on closure details. You should work on closure details like the room, building, and time frames, which may take 2 to 5 days per CDC guidelines. Testing. Current MDHHS recommendations for testing are anyone experiencing COVID-like symptoms, close contacts and probable cases, and those working outside of the home. Now, those are broad recommendations, so pretty much anyone can get a test. The CDC current recommendation states the CDC does not recommend universal testing of all students and staff. Implementation of a universal approach to testing in schools may pose a challenge, such as lack of infrastructure to support routine testing and follow up in the school setting, unknown acceptability of this testing approach among students, parents, and staff, lack of dedicated resources and practical considerations related to testing, minors, and potential disruption in educational environment. The health department will recommend testing and may assist schools in rapid testing through our lab or drive-through testing in the community, which we have at Great Lakes Base for those needing testing.
Thanks, Dr. Pruitt. I'll just introduce Tanya really quick. So thanks, appreciate that. I know it's a lot of information that we tried to go through quickly. And again, we'll have the slides available. Just kind of wanted to hone in on just, I think what we thought was maybe some of the biggest factors that you're thinking about. You know, do we have to screen or test all of our students and staff? Do we have to, screen the staff? We are recommending that you do implement a screening strategy for staff if you can, because that actually is creating a culture around healthy behaviors. It's also going to send a message to your staff that even though they should be checking their own temperatures on a daily basis, if they do it when they come into the school environment, then they're less likely to show up when they may not feel well or they may be experiencing a temperature. And so those are kind of some of the recommendations that we're coming out with at this point. And again, we can have more discussion or dialogue around some of those topic areas moving forward. But what I wanted, Tanya's our nursing director, and so oversees really all of our COVID investigators and all the contact tracing that we've been doing since the beginning of COVID. And so Tanya's really very knowledgeable about how our internal processes are working and gets all the questions from businesses and organizations on all the nuances. So if you can imagine a question, she's probably gotten it at this point in time. And so schools we know will have their own set of unique questions and concerns, and this environment's going to look a little bit differently. So what Tanya's going to go through is really talking about what does that look like when you get that first positive case? What are we saying as a health department is the processes that you're going to expect to hear or see from us, and how you're going to interact with the health department. And again, the better we can streamline or be more efficient with working with all of you, we're open to ideas and suggestions with that. So with that, I will turn it over to Tanya. Tanya, if I will try to advance the slides, but you can always tell me, hey, next slide, if you need to.
Perfect, thank you. Thank you, Chris. So you've developed your plans, you've put your safety measures in place, and you still get that first case. So the health department, as Chris mentioned, we've developed protocols and they will be on our website. I think it's important to note what with someone less than 6 feet for at least 15 minutes. So passing someone in the hallway is not a close contact. If you're speaking with someone in a classroom for less than 15 minutes, that would not qualify as a close contact. If you're riding on the bus next to someone who is positive, even if you're wearing a mask, that is a close contact. If you're riding in a car with someone who's positive, that's a close contact. If you're sitting with someone at lunch or anytime that you're less than 6 feet away from them and they're positive, that is defined as a close contact. So I think it's important to know what a close contact is, because when you get that first positive, that's what we're going to be asking, who by definition is a close contact to the positive case. Next slide, Chris. I think it's important to note that our case investigation and contact tracing is to decrease transmission of the virus. I think it's important that everyone knows that it's not meant to be punitive. We need to know who people were in contact with, again, so that we can decrease transmission. So you have that first case, you get that first notification, and more than likely you will get that information before we do. So maybe a parent will call in. If it's a staff person, the staff person will notify you. When a positive is reported, please contact the local health department. You will need to contact the local health department that the person reside in. So if it's a Saginaw County resident, contact our CD office. The number is listed on the PowerPoint, 758-3887. And in order to look up that case and start our investigation, we'll need the person's name, their address, their county of residence, the date of the positive test, or the date the symptoms began, and if known, if it's, we'll also need to know if it's a student or staff. At that point, we can start our investigation. Now, we may have the information because our positive notifications comes through the Michigan Disease Surveillance System, but again, you may get it from a parent, a staff, social media, I don't know how you'll get it, but I'm sure you'll be first. Once you get that notification, also start filling out the form. And it's the form that we use to collect data. And again, it will be available on our website, and I believe it's on the next slide also. Now, from the school perspective, the things that you need to start thinking about is identification of those close contacts. So someone less than 6 feet for 15 minutes or more with the school. So the school will need to do that, and using the guidance that we'll have on our website. And the second thing you need to start thinking about is the notification to families. How will you do that? Will it happen district-wide, building-wide? I'm sure it depends on the first step based on who contact those close contacts. Next slide, please.
Mm-hmm.
So the data collection form is on, I guess, my left side of the screen. And that's where we would need you to start collecting information on those close contacts. So who the close contact was, their date of birth, their address, because again, the case will be investigated based on the county of residence. And so once we have a determination from you for the school contacts, our nurses are still working with the positive case, because although you will get the information on the school contacts, we will be getting information on all those other contacts, whether it's community, home. So those contacts, if it's a student and there are siblings in another school building, those contacts will be given to us. So you do not need to contact another school. We'll get that in terms of household contacts. And if a sibling is a contact to a positive case, again, that just means the student is a contact and there is not any exposure for that student. So that student would need to be quarantined, but other buildings would not need to be concerned that that student was positive, as long as the student has not had a positive case. So once the data is collected, we can make a determination on, is it just closure of classrooms? Is it closure of a wing? Is it closure of the entire school? You will also use that information to determine any cleaning or disinfection. I think Dr. Pruitt mentioned that you would want to wait 24 hours before you go in and clean a room. But cleaning is determined based on the number of contacts and where that positive case had visited in the building. And you will also start to work on contact notification. In terms of cleaning and disinfection, as I just mentioned, you will wait 24 hours before you go in to disinfect. And again, where you clean will be determined based on where the positive case had visited the building. The staff that does the cleaning need to wear surgical masks, gloves, and face shield when cleaning those areas where a positive case has visited. Guidance for cleaning and disinfecting can be found at the link on the slide. In approved cleansers, EPA approved cleansers can also be found at the link. Now, per AAP, when possible, only products labeled as safe for humans and the environment containing active ingredients such as hydrogen peroxide, ethanol, citric acid should be selected from the list because they are less toxic and they are not respiratory irritants or asthma triggers and have no cancer effects. When you're cleaning, you want to make sure you follow the label directions for safe, effective use. Make sure you're reading the guidelines to follow the contact time, which is the amount of time that the cleanser needs to be on the surface and have the surface visibly wet to be able to wipe away the virus. Again, the CDC recommendations for school and child care closure is 2 to 5 days, and that is so that you're working with the local health department for any cleaning and determining close contacts and notification of those contacts, as well as other schools or district communities. Next slide, please. In terms of cleaning your buildings, daily cleaning should be classroom, desk, table, chairs, all of those surfaces that the students will be using. Now, multiple times a day, you should be cleaning those high-touch surfaces like door handles, light switches, handrails, drinking fountains, sink handles, restroom surfaces, cafeteria and surfaces, and elevator buttons. In terms of toys, art supplies, and other materials, they should be cleaned between each use, especially seats on the bus and any computer or library type equipments that are being used. So you have had your first case. You are working with a local health department. You have determined who those close contacts are. So depending on that information, that will determine the protocol for notification of families. So the close contacts must be notified of their exposure. They will need to understand that they need to self-quarantine for 14 days from the last date of exposure, and then follow up with self-monitoring, and that health department representatives will do that follow-up, that daily follow-up. I think it's also important that they know that although they need to self-quarantine from school, they need to self-quarantine from other activities also. Oftentimes we contact those close contacts and remind them that they should not go to work, or they should not go to school. They forget that they should not go to church, or they should not go to the shopping mall. They need to self-quarantine from all activities until that 14 days from the last exposure has lapsed. Second, in terms of notification, it is a broader family notification should be considered at this point based on who's at risk. This would be information to let parents know either the school building wide or district wide that there has been a positive case, and that the close contacts, those close contacts have been notified, and any cleaning and disinfection protocols has also taken place, as well as any closures. Now, when we first got our first case in March, it was, I think the first case is always the hardest case, because the media and social media and everybody wants to know exactly what happened, what's going on, and we do understand that confidentiality is important. So when we're doing our notification, we understand that it's important that the contact know that they've been exposed, but it's not as important to know who exposed them. So we do understand that, and I hope that you do as well. Next slide, please. So those that are positive COVID cases, we need to talk about them returning to school or work. And there are two methods to determine when they're able to return to school or work. So there has to be, it's either the symptom-based method or the test-based method. So for the symptom-based method, they have to have all of these. So it has to be at least 3 days have passed since they've had a fever without the use of any fever-reducing medication. They have to have improvement of their respiratory symptoms. So they no longer have the cough, or the cough is resolving, any shortness of breath is resolving, and it has to be at least 10 days since their first symptoms. So they have to have all of those. The test-based, they have to have 2 negative results spaced at least 24 hours apart. And the test has to be completed by a medical professional. So you can either use the symptom-based or the test-based. Most often, the symptom-based approach is what we see being used in terms of students returning to school or people returning to work. For the most part, is symptom-based. So they, again, no fever, without
Did we lose it? Okay, can you guys hear me?
We can hear you, Christina.
Yes, yes.
Okay, thank you. Good. I'm sorry, my screen froze for a second there. So I'm assuming Tanya was done. Tanya, were you concluded with your comments? I lost her here. Or maybe
Looks
we
like
lost
she's gone.
Oh, we might have lost her. Maybe we lost connection on her. Well, if that's the case, maybe she'll jump back on. So this was my spot to take over. So I guess I will jump in then here and take over in terms of our open discussion. So what I wanted to just throw on the table is, what other questions do you have for us right now, whether it's myself or Dr. Pruitt or hopefully Tanya jumping back on. The data question that we had in terms of communications, I had read somewhere, I think in guidance about weekly updates to schools. And so if we want to talk a little bit about that, or what else are you looking for in terms of guidance? So this is just kind of really to open up the floor. So I'm going to stop my screen share for a moment so that people can share their videos and we can start that dialogue if you'd like. I did see a chat. Yep. Okay. So with that, do we have questions?
You want us to just ask questions just open or through the? Yeah. Okay, so I got a question. So we have 10 kids that come to the office and they all have a runny nose and it's November. What would you suggest we do in those cases? Go through the whole protocol? Because that would be fairly normal in a normal school setting.
Right. So
You're muted. You're muted still. Dr. Pruitt's going to answer that. Got to unmute yourself. There you go.
I assume that most schools will have either a hybrid program or online program of some sort. And so I would recommend, because of the whole runny nose situation, kids live with runny nose. This is what they do in the wintertime, and I understand that. It makes it very difficult. I would tell the parent if a child has a runny nose that they need to stay home, send them a packet of work to do at home. They need to see their physician or healthcare provider to determine if it's allergies. Then they need to have some kind of nasal spray medications for their allergies, so that kid doesn't come in with a runny nose. And I understand that's a large population of your students will have a runny nose, and it's difficult to determine, if they do or don't have COVID-19. So I think to err on the side of caution, kids with runny nose really should stay home.
Would it be with the idea that they're 3 days without symptoms, or they come back with a doctor's note to readmit?
I think the doctor's note would be helpful, and the doctor can help determine if the child has COVID-19 or not, or need to be tested or not. And determine if it's something other than, if they just have chronic allergies or something like that, that can also be determined. But definitely, I would think some medical attention and advice would be needed to make sure that you're not allowing a kid with COVID-19 to come into the school system. know I heard somebody say, wow, I get it.
We heard, this is Bruce Martin, Saginaw Township, we heard some editorials on the use of the thermal scanners and all the cute iPads on the stands and all those kinds of things. We heard some pretty solid indictments of those, that those are highly inaccurate and incredibly expensive. Is the health department encouraging those, pushing those, or in agreement with some of these other folks that are saying that we really are not, we're spending our money on them other than it makes the parents feel really good?
Chris, do you have any idea about thermal scanners? I know some places have them.
Yeah, so I think that there's a large variety, and obviously with COVID, there's a lot hitting the market. And so there's, a lot of consistency. If you're thinking about getting some element around your staff screening piece, then yeah, doing your research. The county's been looking at doing some screening mechanisms as well to alleviate staff time that people have to come up and get the scan done. And so doing your research on those in terms of the indicators around the quality of the data is one. On the flip side of that, though, what we're hearing about, I guess, and seeing in terms of self-screening, if you go to a self-screening method and said that, obviously we're sort of recommending that for students, because I just don't think it's realistic for any of you to try to screen students coming in just with the sheer numbers. Unless some of you think that logistically you can do that, by all means, go ahead. It's not necessarily the recommendation coming down, but for staff, it is, I think, a better practice. And like I said, kind of creates that culture around creating a safe environment for students. And so if you do it for the staff, then thinking about self-temperatures versus them having to show up and get their temperature taken, I do think presents a little bit of a different mindset for folks, where a staff member may be more likely to come in if they're going to self-screen, and then there's no guarantee that they're doing that self-screening, right? So you're taking the teacher's word that they're just showing up that day, that they don't have a fever, they don't have signs and symptoms, versus sort of a checkpoint that says, asking them themselves, do you have those signs and symptoms? And the temperature is just one of the indicators, right? So you can say, well, you're less than 100.4, so at least we know you don't have a temperature. Is any of those things foolproof? We know they're not. Some people present and have active infection, don't have a fever. Most of them do develop it, but if they're in the early stages, they may not either. So nothing is a foolproof strategy. So I think you have to think about logistically, financially, what works best for, each of your districts are different in size, and how many teachers you've got, and the feasibility for all of that.
Well, and this is Matt from Swan Valley, I want to follow up with Bruce's question. Because these are so new, research is difficult. Can't find any schools that have had them in place prior to COVID. But out of convenience, I think a lot of us are considering limiting each building to one entrance and having students pass through these. I guess we're just keeping our fingers crossed in terms of how well they work, because to be honest, in the school world, we can't trust that our parents do the pre-screening before kids get on the bus.
Right. And I completely agree with you there. I think that if you do go to the self-screening, then, it's going to be a lot of communication. It probably will have to be constant. How do you get parents in that habit of doing that before they put the kids maybe on the bus? And, you virtually have no control of what happens once the kid gets on the bus, right? And so it does present some unique challenges. But if you are able to put the resources forth for something like that, again, it's an element that you're at least doing something, right? In terms of the validity of it, I know it's hard. And I can't really speak to all of what's on the market out there for that.
Thank you.
Christina, this is Julian Petzold. You had some graphs up earlier with percentages and some different things. And do you have any idea what the sheer numbers of students in Saginaw County? And is any of that being used to determine phases in the county, or are we just subject to what the governor decides? Or do you know if that's getting back to her people? You know, I mean, I see percentages and numbers, but do you have actual numbers of student age in Saginaw County?
Yeah, we do have on our website where we break down the age groups.
Mm-hmm.
So we see there, and I believe
7.9% is less than 0 to 19.
Okay, so 0 to 19 is the first age category, which I believe is the lowest percentage of any of our age distribution breakdowns. So we do know we see, and we're continuing to see, less infection rate among the students and the younger population, just as we mentioned. And so that has continued to be consistent. But that data we do post on a daily basis as well. In terms of how that's feeding into the governor's plan, you know, I think that most health departments are really looking at age distribution in addition to all the other factors that we're looking at and tracking. All of that data is being pulled from that same disease surveillance system that Tanya had mentioned. So their epidemiologists at the state are pulling that data, and they're kind of looking at that statewide, you know, and how that's influencing the roadmap and where we're moving for schools. You know, probably is to a certain degree. I just don't know exactly.
Okay, and Dr. Pruitt, when you say 7.9%, I haven't seen that, so I appreciate you sharing that website, because I'll get there and take a look at that. That's 7.9% of all cases in Saginaw County?
All tested, all cases that have, yes, positive cases. Yes.
All positive cases, yeah, okay.
And that's at our Saginaw County website.
Yeah, if you go to saginawpublichealth.org, click on the coronavirus, and then the first, I think the first one to click on is cases in Saginaw County. You pull that up, it gives you the map where we have the sort of municipality distribution by the number of cases, and then it breaks down our positive cases in addition to deaths.
Okay, I'm down here in Macomb County. I start up in Saginaw County August 1st, so I'll be up there, you know, in a couple of weeks. So, okay, thank you.
Okay. Mm-hmm.
I just want everyone to know too that, you know, as a physician that has been like taking care of patients for over 17 years in Saginaw County, one of the things I know that schools do a really good job at is when they can recognize somebody with pink eye, they go, pink eye. And even if it's bacterial conjunctivitis, it could be allergic pink eye. There are a lot of reasons why people could have pink eye. You guys are still so vigilant at sending them out of the school and to the doctor's office to get checked. And even though I know kids were running those signs of colds during the winter time, it's very common. We want you to be that vigilant to try to keep out kids with COVID-19 out of the school system. Okay, so just send them to get checked if they need to be.
So since other people aren't saying much, I'll ask another one. Bruce from Saginaw Township. Let's face it, in the world we live in, especially when you're in the middle of a health pandemic, the county health department carries a whole lot more weight than the school district does. Recognizing the position we're in, if we say, look, I understand you're upset, mom and dad, this is right from the health department, they're the experts when it comes to medical health issues. That helps us significantly because at the time they're upset and angry and they're wondering why we're doing X and Y and Z. So I appreciate you folks being willing to take on that role, and I know that's part of your job, just like educating kids is part of our job and everything. But there are going to be times when we're going to have to use your title as leverage for why we're doing some of the things that we're doing. And now, of course, the responsibility is on us to make sure what we're doing is compliant with the expectations and the guidance from you folks. So as a tangent to that, I'm understanding that when it comes to the closures of buildings and of districts, that guidance will come from you folks depending on situations. Or is that a superintendent decision that's made? I'm going to close this elementary school today because we had I'm hoping we can be in partnership on those kinds of things. And you know, I'm not a medical expert, you folks are, and I feel uncomfortable making those kinds of things. So I think I picked that up in the PowerPoint, that some of those closure kinds of decisions will be based on you folks will be taking the lead on those. Is that correct?
Yeah, I'll start with that. I think that you bring up a great point, and that's why we tried to reiterate that it is not a cookie cutter approach. And you guys know that anytime you see flu going through your school, or we talked about pandemic in the past and disease spread, and do you close, do you not close, and to what extent do you close? And so I think that we're here as a resource for you to provide guidance in terms of possible exposure, the scope of this outbreak, with information that you have to provide us in terms of direct close contacts. You know, how many are we talking about? What is really the risk level? And we are here to help guide that information for you to then say, okay, is this just a building that needs to be closed? Is this, more widespread than what we thought? And we've got kids in all different buildings, so we're thinking about district-wide. You know, that there's so many factors that play into that decision making that it has to be with superintendents and the health department, a conversation that we have when you're dealing with that case or that outbreak or whatever that looks like. And that's why I think CDC is recommending that 2 to 5 days of closure. Because I see Katie put a comment in here about 2 to 5 days for cleaning. And it's really so, as Tanya mentioned, we can kind of get a handle of the situation. So you've got Johnny, who you send home, who looks like he's symptomatic, and you say, hey, Johnny, go get tested. And you contact the health department, and we start working through, okay, where's Johnny been? How many contacts have we had? What are we thinking at this point? And then you as superintendent might just say, you know what, I think we need to close for tomorrow. Let's figure out, let's determine what the contacts are. Let's get in there to clean, be proactive with your families and your students, to give you that opportunity to figure out really what is the best strategy moving forward. So I do see it as a collaborative, and we're here to provide that guidance so that you guys can make those decisions.
Okay, thank you.
Mm-hmm. So I have a question that came into the chat at this time in Saginaw County. How long does it take to get a test result from a reliable test?
Okay, yeah, so I think that's me. So I would say if it's a Quest related lab, then it will be about, I would say, up to 8 days for Quest related. So Covenant uses both Quest and Ward. Ward will take about 3 to 4 days. If you go through Great Lakes Bay, they use a whole nother system. It could take up to 24 to 48 hours. So just to let you know that some of it could take a couple of days, and then some can take up to, I would say, 8 days. I would say in general, if there's an outbreak, we at the health department may be able to assist. You could call us and let us know. Like we said, there's some community areas where you could get it quickly, like at Great Lakes Bay. However, at the health department, we do have like a 24-hour turnaround for just very few cases. So if you are overwhelmed with cases or something like that, we may be able to help here.
Hi, Delisha. This is Angela Williams from Great Lakes, and our latest update policy, it takes 10 days with Quest now to get a test result back. And we are advertising that on our website as of last week.
Okay.
Thanks, Angela.
Thanks, Angela.
Okay. Are there any more questions?
So I'm hearing that face shields are a lesser inferior option, but still an option if there's a medical intolerance, something like that.
Yes.
Okay.
It provides some protection.
Okay.
This is Joe Berkmeyer from Bertrand High School. Earlier, it was asked about runny noses, and the suggestion is going to get tested for that. So it sounds like if students are to have a runny nose, we're going to suggest they get tested before they return to school. And now it sounds like that would be an 8 to 10 day process to get the results on that. Is that correct?
So I'm sorry if I misstated. My suggestion was for children to go be seen by their doctor to determine if they needed testing. That I gave an example. It could be just allergies and then some allergy medicine, nasal spray and or Claritin, Zyrtec, something like that may be able to slow that runny nose. So no, not every child with a runny nose needs to be tested. But kids with runny nose, my favorite, I have twins and, they take their arm sleeve and just kind of wipe it across with their runny nose instead of getting any Kleenex and things like that. So it's easily spread. So my suggestion is to recommend that they be seen. A lot of doctors are seeing kids by telehealth. So it may not take long to get in a doctor's office, but to be evaluated to determine if they need testing.
Okay, thank you for that clarification.
Okay.
And again, here's our link. We'll share the PowerPoint obviously after this, and probably this recorded webinar as well, that can be shared with others within your district if you need to, and whoever's sort of writing the plans or whoever ends up being sort of your point people to help with some of these resources and guidance and communications. So on SaginawPublicHealth.org, on our coronavirus page, we have a specific schools and childcare facilities where we're finalizing a lot of the school guidance documents that you've seen in the PowerPoint, and they'll be posted there. And obviously, we'll update these as necessary if there's specific other pieces of guidance. Bruce, you mentioned in terms of, things coming from the health department, if you want us to draft some school letters in terms of, things being or coming or recommendations from the health department, we'd be happy to do that to help assist you guys in any way that we can. Currently, this is what we're developed so far. It'll be posted at least by tomorrow. We're kind of finalizing these documents as we speak. But case reporting, so what to do form, which is really going to be hopefully a good tool for that first positive case. You can go to that sheet. It's really what the health department needs and just sort of a checklist of things to consider as we move forward. Contact tracing process and evaluation that Tanya went over as well. So kind of outlines what that process looks like. And then an FAQ for parents, which could be sent out before school start or as you communicate with all of your families about how school is going to look. If there's other resource documents that you want to include with that from the health department, let us know. I'd be more than happy to try to put something together for you guys. And then lastly, as we sort of wrap up here today, then if it is a Saginaw County resident, whether it's your staff member who lives in Saginaw or your student lives in Saginaw, then you can, again, reiterate to call that communicable disease number to kind of initiate that first part of reporting, because as the executive order states, you are required to report it to the local health department. Ideally, as Tanya said, we will get it through our disease surveillance systems, but through your family communications, we know that you'll probably be the first to get some of those communications. And as we've seen earlier in March and April, I got a lot of phone calls from some of the superintendents hearing about volunteers helping do school meals and things like that they were worried about. So a lot of times you may know before we do. And if it's vice versa, then we'll be sure to communicate with you. If you've got kind of follow-up fielding questions or just planning guidance, what we wanted to try to do is just kind of help streamline that a little bit. I would say our emergency preparedness coordinator, the superintendent, met her when I met with you guys face-to-face back in March. Carrie is a great resource to kind of help either point and direction or field some of what you guys all need, and that we can kind of respond collectively. But obviously, if you need to reach out to myself or Dr. Pruitt or to Tanya, our contact information is there. And then wanted to kind of further outline our 24/7 number. So this is not available to the general public, so please don't share this. because we don't take public emergency calls for COVID, or else probably our phone would never stop ringing. This is really for stakeholders and community agencies that need to report to the local health department on an after hours or weekend basis. And so I wanted to provide this number to you because you may, just through your mechanisms, I think it's probably realistic that on a Sunday afternoon, you may get a phone call that says, you know, Susie Smith is positive, our second grader or fifth grader or whatever. And you obviously will need to make some decisions before Monday, right? Are you going to send out a notice to close the school, or you want to get that going before school opens on Monday, and then we have, you know, potential for more exposure. So you can call the 24/7 number. That's the 776-5444. And that really would be ideally through superintendents. It's answered by a King communication line, which is an answering service for us. So they kind of have strict protocols of who they let through because, again, we don't want just the public calling this number. So that is a resource for you as a school to get a hold of us if it is a night or if it is a weekend and you get that report and you feel like, hey, I need to take a quick decision about closure, or this is what I'm thinking, and we're going to close elementary school tomorrow, and you know what's our next steps or our next step process. So what happens is you call that number, you tell them who you are and what's happening. They take the message, and then we have leadership that's on there to rotate on call. And so somebody will call you back and initiate kind of an investigation, if you will, at that point in time. So with that, I will stop. Just click here, make sure. The decision tree flow chart would be very helpful. And the evaluation of close contacts hopefully will meet that. And then countywide language, obviously, we're more than willing, and anything that we do develop will be available to all schools as well. So we understand the ISC is very focused on trying to create some consistent language and policies and procedures, and are more than willing and to help you guys in doing that in any fashion. So I thank you all for your time today. Thanks for participating, and if you have follow-up, use your contact information, and good luck in your further plans. Thank you, guys.
Bye-bye.
Have a good day.
Bye. Thank you.
Chris?
Yes, Bruce.
Can I ask a question while we've got some confusion on, are we currently under the 10 people or less for inside meetings, or has that been changed to 50 now? I'm getting conflicting messages. People said, no, that was the old March, April, May, June thing where we can have inside meetings now of more than 10. And I thought we were still under the 10, and I thought, well, perhaps you guys have some insight in that.
Well, the recommendation still is 10, but it's an indoor public gathering. And so I got that question earlier, and we were looking at the guidance around businesses. So the last business guidance, I think, and I can't recall which executive order this is in, but businesses that are open, that are able to operate, can do so and have in-person meetings as long as social distancing of 6 feet can take place. So the 10 is really for mass gatherings. So people not within the same household as a social gathering is limited to 10.
Okay. So I want to get my principals together to hammer out some of these plans. There's 11, 12 of them, and we're trying to figure out, can we meet inside our conference center, spread everybody out, wear masks, hand sanitizer on the desk? No, we can't because that's more than 10. And I'm confused. I'm not sure how to.
I'll look up the executive order on businesses, and I'll send it to you, because my interpretation, and I'll double check, but I believe that you can do that. Social distance, 6 feet apart, and because it's not a public gathering, it's operations of a business.
Okay. All right. Yeah, that'd be helpful. As you know, these executive orders all run together after a while.
They
and
do.
If there's so much information flying back and forth, you feel like you missed something. And so.
Absolutely.
Okay.
Another way to do it is just to have 10 people in a room and then have 1 or 2 of them remote.
Yeah. We've had to do that just because people are not comfortable getting together. Or
Exactly.
something, but
Yep.
okay. All right. That's very helpful. Thank you both.
You're
Have a good
welcome.
You're welcome.
Thanks. You too.
We're here if you need us.
I greatly appreciate it. We'll be talking a lot, I'm sure.
Okay.
Well,
All right, good. Bye-bye.
Thanks.
Bye.
Bye.